I want you to consider something carefully. Most people believe that if a surgery is successful, everything returns to normal. The problem is fixed, the risk is gone, and life continues as it was before. But what if that is not completely true? I used to believe the same thing until I started paying attention, not to what happens inside the operating room, but to what happens after patients go home. I began to notice a pattern that was difficult to ignore. Patients who survived. Patients whose reports looked perfect. Patients whose surgeries were described as complete successes. And yet, something about them had changed. Not worse in a way that appears in tests, but different in a way that families feel immediately. Let me give you a clear picture. A 74-year-old man, independent, mentally sharp, living a structured and active life. Someone who handled his own responsibilities, maintained his routine, and valued his independence. After months of discomfort, he agreed to a routine surgical procedure. He was told it would improve his quality of life. The surgery went exactly as planned. No complications, no surgical errors, no warning signs. He was discharged on time. His wound healed. Every follow-up report was normal. But a few months later, his family began to notice small changes. He was quieter, slower to respond, less interested in conversations he once enjoyed. The activities that once defined his daily life no longer seemed important to him. When his family tried to describe it, they did not use medical terms. They said something much simpler. He came back, but not the same. My name is Dr. Wilson, and for more than 20 years, I have focused on a question that is often overlooked. Not whether a patient can survive surgery, but what kind of life they return to afterward. Because there is a reality many people only discover too late. A surgery can be technically perfect, every step done correctly, every medical standard met. And still, the person who returns home may not be the same. The first change often happens in the mind. It usually begins subtly. Small memory lapses, difficulty focusing, occasional confusion. At first, these moments seem minor, but over time, they begin to form a pattern. Families start to notice. Something feels different. This condition is known as post-operative cognitive dysfunction, but the name is less important than the experience. The person who once handled complex conversations now struggles with simple ones. The person who remembered details easily now repeats questions. The person who felt mentally sharp now seems distant. And the most concerning part is this. In older adults, these changes can last for months. In some cases, they may not fully reverse, and many patients are never warned about this possibility before surgery. The second change is emotional, and it is even harder to recognize. Because it does not look like a medical problem, it looks like personality. After surgery, some patients begin to withdraw. They lose interest in things they once enjoyed. They avoid social interaction. They describe a feeling that is difficult to explain, a kind of emotional emptiness. This is often dismissed as normal recovery. But in many cases, it is post-surgical depression, driven by physical stress, inflammation, pain, and loss of independence. A person who once felt in control of their life may now feel disconnected from it. The third change is physical, but not in the way most people expect. When people think about recovery, they focus on healing the surgical area, but they often underestimate what happens to the rest of the body. In older adults, even a short period of reduced movement can lead to noticeable muscle loss. Strength decreases, balance becomes less stable, energy levels drop, simple actions become more difficult. Standing takes more effort, walking feels slower, stairs become challenging, and with each difficulty, confidence begins to decline. As confidence declines, activity decreases, and this creates a cycle that slowly reduces independence. The fourth issue is persistent pain. This is one of the most confusing experiences for patients. The surgery appears successful, the wound heals, the reports look normal, but the discomfort remains. Weeks pass, months pass, and the pain is still there. This is known as chronic post-surgical pain. It happens when the nervous system continues to send pain signals even after healing is complete. For the patient, this can feel isolating because they are experiencing something real that is not always visible in medical tests. The fifth and most personal change is the loss of identity. This is something no medical report can measure. For many people over 60, daily routines are not just habits. They are part of who they are, their independence, their activities, their sense of purpose. When surgery interrupts these patterns, even temporarily, the effect can be deep. The person who once felt capable may now feel dependent. The person who once felt active may now feel limited. And slowly, they begin to feel disconnected from their own life. So this brings us to an important question. If the surgery was successful, why does the outcome feel incomplete? The answer lies in how success is defined. In medicine, success often means the procedure achieved its goal. But for patients, success means returning to a life that feels normal and meaningful. When those two definitions do not match, the result can feel confusing. This is why the conversation before surgery matters so much. Because the right question is not only what will this surgery fix, but also what might it change? What will recovery look like for someone of my age and condition? What risks exist beyond the operation itself? And how can those risks be reduced? These are not negative questions. They are necessary ones. I want you to remember something simple. The surgery is one day, but recovery is the life that follows. And the more prepared you are, the better your chances of returning to yourself. Because the goal is not just to survive surgery, it is to come back to your life. A successful surgery should not cost you the person you were before it. If you have ever seen someone change after surgery, even when everything seems successful, share your experience. Your story might help someone else make a better decision. And if this gave you a new perspective, share it with someone who needs to hear it. Because one conversation at the right time can change everything.